Salamat po at magandang araw po sa inyo lahat. Nagbabalik ang inyong programa ng Action Central Zone Special Edition. Ito po si Sunny Lopez at alam niyo naman po, isa po sa segment ng ating pong programa, lalong-lalo na po ngayon yung tungkol po sa kalusugan ay mas malawak po ang ating discussion. Ito hong topic na didiscuss natin ngayong araw na to importante para sa mga taga-Angeles, San Fernando, Pampanga at buong Pilipinas mga kaibigan. Ito po ay tungkol sa HIV, tungkol po sa AIDS. Alam nyo na yan mga kaibigan. Kaya po nandito ang aking co-host, ang taong laging nagpapapagod para mag-invite po ng special guest na makasama po natin dito sa ating programa, si Dr. Rowie. Dr. Rowie.
Thank you, Sunny. So, we have a new topic, no?
Yes.
Maganda and very interesting. We hope you would stay with us and we will inform you about this alarming case.
Although we don't want to alarm anybody, we want to inform everybody so that mag-ingat po tayo, mga kaibigan. Okay? So ang ating pong special guest for today is sa infectious disease specialist po. Siya po ang chairman ng HIV Treatment Center sa Jose B. Lingad sa Regional Hospital po natin sa Gitnang Luzon, si Dr. Edwin Pasumbal. Sir. Magandang araw po. Okay, doktora. Siguro yung definition ng AIDS, HIV para alam ng ating mga viewers, no? Doc, please.
Okay. So, ang ibig sabihin ng HIV ay human immunodeficiency virus. So, it is one type of infection na caused by that virus, yung human immunodeficiency virus. At kaya yan nakuha ang ganyang pangalan is because it has a unique way of destroying little by little the immune system of the person.
Okay.
No? Ito po ay nagsimula I think way back 1980s, no? First I reported cases in the United States, New York and San Francisco. During that time, ang tawag pa noon ay gay-related immune deficiency.
Or gay cancer, right?
Yes, or gay cancer. Because it was parang exclusive only sa mga gay men presenting with pneumonia and an unusual skin lesion. No, but later on, na-discover nila na ito pala ay sanhi ng isang virus. No? Kaya tinawag po itong HIV or human immunodeficiency virus.
Tapos ano naman po yung AIDS?
Ayan, okay. Marami sa atin ang may paniniwala na ang HIV is actually synonymous with AIDS, no? But HIV, and AIDS are two different things, okay? When we talk about AIDS, AIDS stands for acquired immune deficiency syndrome. It is just part of the clinical spectrum of HIV. Siya po actually yung AIDS ang advanced stage ng HIV infection. So, a patient with AIDS definitely has HIV infection, pero hindi po nangangahulugan, it doesn't follow na pag may HIV ka, automatic may AIDS ka na. Okay, so they are not synonymous. Yung AIDS is just part again of the clinical syndrome of HIV infection.
Okay, doktora?
So, Doc, is there a cure for this?
Okay. Sinasabi natin yan, there is still no 100% cure for HIV. But, fortunate to say na meron ng available na treatment for HIV infection.
Before you go to the treatment, can you tell us about the latest statistics that we have here in the Philippines?
Okay. Based on the HIV registry of the Department of Health, medyo alarming ang ating data as far as incidence of HIV is concerned. Because starting year 2006, we have witnessed an increasing number of patients diagnosed with HIV infection.
What's significant about 2006? Why the significant increase, the jump?
Okay, opo. Na-identify po kasi medyo nag-iba din yung demographics din, Kasabay ng pagtaas ng kaso ng HIV, sa Pilipinas, nag-iba din po yung mga tinatawag na persons at risk, at yung demographic picture, ng HIV. Now, we are now facing a changing trend or a changing phase of HIV infection.
When you say changing trend, what do you mean by the changing trend?
in terms of the phase of HIV infection, nung unang first reported cases of HIV in the Philippines as early as 1980s. Noon nakikita lang siya sa mga commercial sex workers, female sex workers at that. No, and then come 1990s, no, and early 2000, na-identify din ang HIV among the seafarers, OFWs, no, yung mga seamen, no, in addition to the commercial sex workers. Ngayon, ibang-iba na po ang trend ng ating HIV because it's the young people who are at risk
When you say
for
young,
HIV.
how young bang nakita ninyo?
As young as 18 years old.
So I have here in your Department of Health the chart from the National Epidemiology Center.
Yes.
They have youth from 15 to 24-year-old. Now,
Yes.
from July 2012, you already have you have 89 cases. Or this one, you have
for the young
500.
kids. Yeah, but for the July 2012 data alone,
That's
there are
89
newly
cases.
diagnosed cases of HIV, 278. Ngayon nakikita natin mga 4 new cases a day. Dati mga 2 cases a month lang natin nakikita, no? Naging 2 cases a week. Ngayon, it's an alarming 4 new cases a day.
So you
They
even
go by
have
the hundreds na per starting 2006 per month. No,
So
yung
you have
nakikita
here
natin
less than
HIV
15-year-old. So from January to July, meron pa kayong 4 cases.
Yes,
no, right?
yes.
So we have to say that we also have a vertical transmission. No?
Yes,
so
that's
from
also
the
very
mother to
important,
the
no?
to
Yung mother
the
to child
child.
transmission
So-
of HIV infection.
So your total reported case here in the Philippines to date is how many?
Around 10,000.
But it's
10,242.
you were telling me that this is probably a case of underreported pa rin yung case na
We
to,
still
right?
feel it's underreported, no? Because even when you look at the global data, that's why we encourage yung HIV testing and counseling. Because around 20% of these patients with HIV actually don't know their HIV status.
Pero let me ask, kasi naman yung iba, una-una, hindi naman nila inis, meron sila, di ba?
Yes.
O sino ba yung ano dyan? Sino ba yung
At risk
At risk,
for HIV.
oo.
Yeah, that's a good question. Kailan ba tayo magsususpecha,
Oo.
no? Who are the persons at risk na
sinasabi
na-identify
mo yan,
natin?
dapat lagi na tayo
Yes.
suspetsa, di ba?
Yes. Number 1, of course, yung sexual activity. Multiple sex partner, no? Or multiple sexual activity is a risk factor. Again, yung commercial and female and male sex workers should be tested for HIV. Patients with previous history of sexually transmitted infection. And then now there's a growing problem in the southern area of the Philippines. No, aside from sexual transmission of HIV, dumadami din ang mga HIV among the IV drug users.
Yung ano.
Yeah, so
Yung nagtuturok.
yeah, mga nagtuturo, no? So these are also considered persons at risk for
So
HIV
there's also a
infection.
mother-to-child transfer.
Yes,
so
and then
yun
the
din
mother-to-child
at risk din yung mga yun.
transmission.
But I wanna tell this, so for nomenclature lang. Kasi we were discussing a while ago na nag-increase ang MSM.
Yes.
So can you tell us what MSM is or
Okay.
the difference niya
Yeah.
between bisexual and homosexual? Paano yun, Doc?
We were talking a while ago about yung mode of transmission
Yes.
kasi yung sexual mode of transmission. Kasi kasama ng pagtaas ng HIV cases, nagbago din yung mode of transmission ng HIV. No?
Okay.
From 1984 to 2006, usually predominantly heterosexual.
Yes.
Meaning woman to man or man to woman. But 2006 and forward, ngayon it's 85%. It's MSM or what we call men having sex with men na ang predominant mode of transmission ng HIV. So dalawa po yan, no? It's categorized as bisexual,
Yes.
no, encounter. So you have sexual encounter with both the male and the female, and then yung purely na homosexual. No, so you have constant sexual activity with a male partner. And it's very bothersome nga po na yan na ang mode of transmission, predominant mode of transmission ng HIV sa Pilipinas. 85% of the mode of
Nowadays.
transmission, it's MSM already. And it involves young people,
Young people.
the teenagers.
Okay,
The early
let me
20s.
ask. These are national figures.
Yeah.
But how do you relate this to the regional figures?
Yeah.
So that's good because they have a case, they have a chart here na comparing the National Capital Region. And syempre, we're concerned about the Region 3.
Yeah.
Especially before, di
Yung
ba?
audience pa naman natin,
Okay.
Region 3.
Yes,
no?
and before they were trying to label the call center agents na ganito.
Yes.
So, can you tell us the
Actually, yung
local
data ng
rates?
DOH is very much compatible with our own local data. No?
Okay.
We're talking about the patients enrolled, no, in our or referred to our treatment hub. No? Similarly, ganyan din po yung data natin. 70%, no? Around 70 to 80% males, and these are males having sex with males. And again, these are very young, no, individuals. Again, yung youngest ka namin is around 18 years old.
So, mga estudyante, pwede mga
We had
estudyante.
students,
So, sa
we had,
NCR?
at hindi lang call center agents. So, we have from all
walks of
Factories,
life?
walks of life,
ganyan.
Can be,
different
professional.
professions. Some are even professionals for that matter.
So, you look good. It doesn't mean you're exempted from
Yes.
acquiring
Yes.
this.
Even
And I
a
would-
plain
yeah.
housewife can be exposed.
Yeah, and I would like to point out na yung sa data ng DOH, 95% are asymptomatic. Hindi pa sila, kumbaga yung full-blown na AIDS na tinatawag, no? So, paano nila nalaman? Kasi by voluntary testing, nagpa-screen sila for HIV and it turned out to be positive.
So, you're
They
telling
don't have
us
symptoms at all.
if more people will get tested for HIV, it is the probability is high that we see
We'll get more.
More,
You know?
yes.
We'll get more
Yes,
cases.
more
So,
cases.
sir, so Doc, so sa Region 3 sabi nila, siguro mas mababa naman tayo compared sa NCR.
Yes, majority pa rin ng HIV cases nasa Manila.
Ano yun?
Around
Kasi
50%.
ang testing nandun sa center
not
or hindi?
Not necessarily. Kasi na-identify din even yung at-risk population na yung burden nandun din sa National Capital Region. At ang isang
So it's
nagiging
more
problem pa
urbanized,
natin-
so it
Yes.
follow na.
Yeah,
It
at
will follow the
more urbanized,
increase.
no? At nakikita din natin kasi because of like comparing it sa ating data, no? Yung accessibility din kasi ng treatment
Okay.
we were informed na marami ding from Pampanga
Yes.
na naka-enroll sa Manila, positive cases.
Meaning
no?
mataas
Tested
din-
positive, no, na taga Pampanga, but they opted to
Go to Manila.
Go
go to
Manila.
Manila for because they don't want to siguro yung discrimination for
Yes.
confidentiality reasons, no? Hindi sila dito nag-a-avail ng treatment.
Pero in
So
Pampanga-
marami talaga doon na nag-a-avail ng treatment in Manila. Sa atin, Region 3, around 7%. I think pang-apat tayo, no? In terms of yung number of
Cases.
HIV cases.
So dito sa atin, sa Pampanga, you were telling us a while ago that it's Angeles City and San Fernando,
Fernando.
the city of San Fernando.
Yes,
I'm
sir.
asking this because yung correlation sa urban
Yes.
area, ganyan, itong
Yeah, we
prevalence.
see cases from San Fernando and Angeles City. Although we cater to the the patients of or clients of Central Luzon. No, yung sa registry po namin sa Jose Bilingad, no, we also see patients coming from Olongapo,
Yes,
Nueva
yes.
Ecija, and but majority pa rin are from San Fernando and
And Angeles
Angeles City.
So
Okay.
Doc, yung bang how do you have to discuss to them na here in the Philippines it's different yung the way you diagnose, the way you screen patients compared to the other countries. So can you elaborate further yung paano sila magpapa-screen, paano sila magpapa-test?
Okay.
Iba dito, 'di ba? Kasi they need to get a consent.
Yeah, okay. Dito kasi sa atin, because we have the Philippine law, the Philippine HIV law, no? HIV testing in the Philippines is never mandatory or compulsory. It has to be, we always emphasize, it's voluntary, no? So if if a patient has symptoms suggestive of HIV infection, we really have to
Hindi mo
convince
pa rin
the patient na
pwedeng-
kailangan,
You cannot
hindi
force
pwedeng
them.
magpa-test na hindi niya alam.
Na gusto
No?
niya.
Na kailangan papayag siya
Papayag
na
siya,
mag-HIV testing at meron po tayong proseso, no? Una muna, there's pre-test counseling, no?
Okay.
And then there has to be also pagka-test, meron pa tinatawag na post-test counseling. And then kahit nag-reactive na yan, okay, hindi pa natin pwedeng malabel as positive yung patient. We have to wait pa rin, no? That is just a screening test. No? Yung mga tests na available sa mga hospitals and laboratories. Pinapadala yan pa rin sa Manila no, it's for free, no, sa SACL, STD and AIDS Central Cooperative Laboratory
The confirmatory
in San
test is
Lazaro
free.
for the Western
But the
blot.
screening.
No? So we'll have to wait for that. That might take around another 2 to 4 weeks, no, before the result comes out, no. But based on my experience, no, you correlate always it clinically, no. Lahat naman ng mga naging screening ko so far,
Na nag-positive,
positive
talaga.
Wala pa naman positive talaga by confirmatory.
Sa screening, positive na, yung confirmatory, lagi na
Most likely, no, because when you look at the demographics or the risk factors of this patient, talagang these are really at risk, no, individuals. No? And again, sexual transmission is still the predominant mode of transmission for these young individuals.
Yung oral sex ba, nakakaano yan? Kasi sabi
Oral
nila yung
sex
laway,
is
kahit
low
isang gram
risk.
na lang.
Actually, even kissing is very low risk.
It's still a risk.
It's still a risk, no?
Pero dati hindi pinag-usapan
Opo.
yung ganyan.
Opo. Kaya ang pinakamataas na risk when we talk about sexual encounter or sexual transmission, it is still yung anal receptive.
Yun ang
No?
pinaka-high risk.
Yes. In layman's term, no, sa term nila, they call it the bottom person.
The bottom person.
Okay? And we're talking about unprotected sexual encounter. Around 1 to 4% ang risk, no, for those particular
Is that the reason
patients.
why the MSM is
Yes,
mataas?
that's
Yes.
primarily the reason. Yeah.
Kasi yung pag may injury daw because I've been doing a lot
Yes.
of interviews and research on this. In fact, I went to Thailand for this.
Yes.
Yun daw, pag may injury palagi, ganyan, hindi naman natural na pasukan yan ng penis, di ba?
Yeah, it's a tight area and there are a lot
Prone
of
to
blood
injury.
vessels. It's really prone to injury. And during an unprotected sexual intercourse, of course, mataas ang viral burden, no? Sa
Transmission.
seminal fluid.
Yes, the fluid
It's one of the
will
highly
go through the
kumbaga,
injury.
infectious fluid, no, containing the virus. So pag lumabas yan, na-expose yung nagkaroon ng wound sa anal area, for example, so ma-absorb yung virus, it will go directly to the bloodstream, and eventually it will cause HIV infection.
Okay. Doc, we're gonna have a short break, and after the break, we will pursue this discussion. Very important po to. Mga guests po namin ngayon, of course, ang aking pong partner, no, si Dr. Rowie, at saka ang ating pong special guest, si Dr. Edwin Pasumbal, who heads the infectious disease, he is an infectious disease specialist, no? At siya po ang chairman ng HIV Treatment Center sa JBL, dito po sa atin sa Pampanga and Region 3. Pabalik po kami, mga kaibigan.